My name is Dr. Atul Bhaskar, Pediatric Orthopaedic Surgeon at the SRCC Children's Hospital managed by Narayana Health. Today I am going to talk about some facts and some myths about cerebral palsy. Cerebral palsy is a disorder of the brain which impacts in early childhood and can lead to delay in milestones as well as contractures and difficulty in walking in the old age group. Now, the common myth which surrounds cerebral palsy is that it is a genetic disease and it can be transmitted. It only happens either after birth or pre-birth if there are any issues during pregnancy or post-birth infection or epilepsy. So it is not a transmissible disease. The second biggest myth is that cerebral palsy can be cured. There is no known cure for cerebral palsy at the moment. People have tried all sorts of medications, they've tried black magic, they've tried stem cells, but there's really no cure for cerebral palsy. The best cure for CP is a multidisciplinary setup where the child is seen by a team of neurologists, therapists, and an orthopedic surgeon, and they are given a comprehensive program to optimize the life of the child. So early intervention is the best for cerebral palsy children. The other biggest myth is that children with CP are mentally retarded. I think this has been propagated since time immemorial, that children with CP have low intellectual abilities, and that's not true. Very few children with cerebral palsy will have poor cognition, but majority of them actually can participate easily in day-to-day activities given the right intervention. So not all children with cerebral palsy have got mental retardation. The fourth myth which is seen commonly is that we should delay the treatment as long as possible so that the child can regain his function naturally. Now again, I think this is another big myth because it is now well known that if these children are referred to an early neurodevelopmental clinic, they tend to do extremely well because they are under supervised program by the therapist. Also, they're given medications to control the spasticity. And also, they have been seen by orthopedic surgeons to look at any contractures or joint subluxation. So, children who are seen in a multidisciplinary setup tend to do much better than if they do things in isolation. The fifth myth is that cerebral palsy and epilepsy are correlated. Not all children with CP have got epilepsy, but certainly children who were born premature, have got lesion in the brain which is significant, can have symptoms of epilepsy. But epilepsy itself is also curable. So it's not that every child with CP will have epilepsy. Finally, we celebrate World CP Day on 6th of October, and in India we celebrate it on 3rd of October. And this hospital, which is the SRCC Children's Hospital, was actually at one time called the Children's Orthopedic Hospital. And Dr. Perin Mullaferoz, who was a pioneer, one of the first women who actually started a multidisciplinary clinic at COH, which is now the SRCC hospital. So we are very fortunate that we can continue the legacy of Dr. Mullaferoz, on whose name we celebrate the National CP Day on 3rd October. And sitting here in SRCC hospital, we have today a very well refined multidisciplinary setup for management of all types of children with cerebral palsy. Even the rehab center which is there as you enter the hospital is world class, and we've got all the facilities under one roof to not only assess the child but to do a comprehensive management of a child with cerebral palsy. Thank you very much.